All right, let's dive into this deep dive on ILD, interstitial lung disease. We're going to be looking at a pretty interesting source today. It's a document that's actually designed to help doctors prepare for their medical exams.
So almost like we're getting a little sneak peek behind the curtain of how doctors learn, right?
Exactly. And even if you're not studying to be a doctor, understanding ILD is super important for anyone who just wants to understand, lung health in general.
And what I find really fascinating about this source is how they use a case study to sort of walk us through the diagnostic process. It really highlights how complex ILD can be.
Okay, so before we jump into the case, can we start with some basics?
Hmm.
What exactly ILD, I know it affects the lungs, but like, what does that actually mean?
So imagine your lungs are like a sponge, right? With all these tiny air sacs where oxygen enters the bloodstream. ILD affects what's called the interstitium, which is basically the tissue and space around those air sacs. And in ILD, instead of being healthy and elastic, the interstitium becomes inflamed and scarred, making it really hard for your lungs to do their job.
So it's like the sponge is getting all stiff and can't absorb air effectively.
Yeah, that's a great way to put it. And here's where things get even more interesting. ILD isn't just one single disease, it's a whole category. It's more like an umbrella term for all these different conditions that can cause that scarring and stiffening.
Okay, so let's talk about the patient in this case study. The source mentions that they use oxygen, but only when they're active. And then there's this whole thing about clubbing in their fingers and toes.
Mhm.
What is that all about?
Ah, that's where the detective work starts. So, clubbing is basically when the fingertips and toes get thicker and rounder, and it
Mm.
can actually be a sign of chronic low blood oxygen levels. It's almost like the body is trying to compensate by increasing blood flow to those areas. And the fact that this patient only needs oxygen when they're exerting themselves suggests their lungs aren't able to keep up with that increased demand for oxygen.
So it's like a little warning sign almost.
Exactly. It's a clue that we're probably dealing with something that's affecting how well the lungs can transfer oxygen.
So what could be causing this? The source lays out a bunch of potential culprits. It's kind of overwhelming.
Yeah, that's the challenge with ILD. Figuring out the root cause can be really tricky. Sometimes it's idiopathic, meaning we just don't know the exact cause. But in other cases, it can be triggered by things like exposure to environmental toxins, certain medications, or even autoimmune disorders where the body's immune system is kind of attacking healthy lung tissue.
Wow. So how do doctors even begin to narrow down the possibilities? It's like finding a needle in a haystack.
Well, it's a lot of detective work for sure. A really detailed medical history is super important. Things like lifestyle, occupation, smoking history, any exposure to hazards like asbestos or silica dust.
So it's not just about looking at the lungs themselves. It's about understanding the person's whole life story, basically.
Exactly. And then on top of that, we have all sorts of diagnostic tools that can help us peek inside. Well, you have chest x-rays, which give us a basic picture, but high-resolution CT scans are even better. Those are like zooming in with a magnifying glass. You can see these subtle patterns of scarring and inflammation that can point to a specific type of ILD.
The source also mentions lung function tests. What do those tell us?
Right, so those are also called spirometry. And they measure things like how much air you can inhale and exhale, how quickly you can do it. One key measurement is called the FEV1 FVC ratio, which basically tells us how much air you can force out in 1 second compared to your total lung capacity. And in ILD, that ratio is often reduced because the lungs can't expand and contract as easily.
It's like trying to blow up a balloon that's already half full, right?
Yeah, something like that. And sometimes a doctor might even recommend a lung biopsy, which involves taking a small tissue sample to look at under a microscope that can help definitively diagnose the type of ILD and rule out other conditions.
Hmm. It seems like getting a diagnosis is like putting together a puzzle. Now, based on this patient's age and symptoms, the source seems to suggest a specific type of ILD, idiopathic pulmonary fibrosis, or IPF.
Right.
Can you tell us more about that one?
Sure. IPF is a tough one because we don't actually know what causes it, hence the idiopathic part. It usually affects people later in life. And it leads to this progressive scarring of the lungs, which makes it harder and harder to breathe.
And there's no cure for IPF, right?
Yeah.
What can be done to help manage it?
You're right, there's no cure at the moment. But there are treatments that can help slow down how fast the disease progresses and make people more comfortable. There are two medications, nintedanib and pirfenidone, that have shown some promise in slowing down that decline in lung function. And there's also supportive care, like oxygen therapy, which can help people breathe easier, and pulmonary rehabilitation, which involves exercises and techniques to improve breathing and quality of life.
So it's about managing symptoms and maximizing quality of life.
Exactly. And in some cases, a lung transplant might be an option, but that's a major procedure with its own set of risks and considerations.
This is all so complex, but we've definitely covered a lot of ground here.
We've got a good understanding now of what ILD is, the many possible causes, and how doctors go about figuring out what's going on.
And we've gotten a little glimpse into IPF, one specific type of ILD.
Yeah, but remember, that's not the only type out there. There are lots of other forms of ILD, each with its own unique characteristics and treatment options. And we'll explore some of those in the next part of our deep dive.
Stay tuned for part 2, where we'll continue to explore ILD. We'll look closer at different types and their treatments, and we'll tackle the big question of prevention. What can you actually do to protect your lungs and maybe even reduce your risk of developing this complex condition? Welcome back to our deep dive on ILD. Last time, we really got into the nitty-gritty of what ILD is, how it's diagnosed, and we even met that hypothetical patient and got a glimpse into IPF, idiopathic pulmonary fibrosis. But as we mentioned, IPF is just one piece of the ILD puzzle, right?
Right. There are so many different conditions that fall under that ILD umbrella, each with its own, quirks and challenges. Even this source we're looking at mentions a few others, and it really emphasizes how complex that diagnostic process can be.
It's like a medical detective novel with a whole bunch of suspects. So let's talk about treatments. We know there's no cure for IPF, but what about other types of ILD? Are there any, magic bullets out there?
Well, if only it were that simple, no magic bullets, unfortunately.
Yeah.
But there are treatments that can help manage the symptoms, slow down how fast the disease progresses, and improve people's quality of life. And just like diagnosing ILD takes careful detective work, so does finding the right treatment. It really needs to be tailored to the specific type of ILD and the individual patient.
Makes sense. So let's move beyond IPF for a bit. What are some other types of ILD and how are they typically treated?
Well, one example the source mentions is nonspecific interstitial pneumonia, or NSIP. It's a mouthful, I know.
It is.
But it's worth knowing about because it's actually one of the more common forms of ILD.
And how is NSIP different from IPF?
Well, for one thing, the patterns of inflammation and scarring in the lungs can look different on those imaging scans. And while IPF tends to have a poorer prognosis, NSIP often responds better to treatment, especially if it's caught early.
Okay, so a bit of good news there. What kind of treatments are we talking about for NSIP?
Well, the first line of defense is usually corticosteroids, like prednisone, for example. Those work by suppressing the immune system's response, which is thought to be a key driver of the inflammation and scarring we see in NSIP.
So it's like hitting the brakes on the immune system's attack on the lungs.
Exactly. But there's a catch. Using corticosteroids for a long time can have some downsides, so doctors try to find the lowest dose that's still effective. And sometimes, if corticosteroids alone aren't enough, other immunosuppressive medications like azathioprine or mycophenolate mofetil might be added in.
Now, you mentioned that these medications suppress the immune system. Doesn't that make people more vulnerable to infection? That seems kind of risky.
It's definitely a balancing act. Suppressing the immune system can increase the risk of infections, yeah. So, close monitoring is super important. Doctors weigh the potential benefits against the risks for each individual patient.
So it's very much a case-by-case situation. Are there any other types of ILD the source talks about that we should be aware of?
Yeah, actually, the source also touches on ILD that's caused by autoimmune diseases, like rheumatoid arthritis or scleroderma, for instance. In these cases, the body's immune system is basically attacking its own tissues. And sometimes, the lungs become collateral damage.
Like friendly fire from the immune system.
Yeah, that's a good way to think about it. Treating these types of ILD often involves getting that underlying autoimmune disease under control, which might mean using medications that suppress the immune system. But the specific approach really depends on the individual and their condition.
Wow, it's amazing how much variation there is within this whole category of ILD.
It really is. And it just highlights why getting the right diagnosis is so important, because the treatment approach needs to be so specific to the type of ILD, how severe it is, and the overall health of the patient.
Now, before we move on, I want to go back to a question we kind of posed earlier. Our source really focuses on diagnosing and treating ILD, but what about prevention? Is there anything we can do to protect ourselves from developing these conditions in the first place?
That's a great question, and one that I think deserves more attention. While there are some things we can't control, like our genetics and how old we are, there are definitely lifestyle choices and environmental factors that can influence our risk.
Okay, so let's talk about the things we can control. Where do we even start?
Well, if you smoke, quitting is hands down the most important thing you can do for your lung health, period. Smoking is a major risk factor, not just for lung cancer, but for a whole range of ILDs too.
I think most people know that smoking is bad for you, but it's always worth repeating. What about other environmental factors? Are there things we should be aware of in our everyday lives?
Absolutely. Exposure to certain dusts and chemicals at work can be a big risk factor for some types of ILD. Things like asbestos, silica dust, coal dust.
So people in certain occupations might need to be extra careful.
Exactly. If your job involves potential exposure to those kinds of hazards, it's crucial to use the right protective gear, like respirators, and to make sure your workplace is following all the necessary safety regulations.
Now, what about things we can do to actively protect our lungs, even if we're not exposed to those occupational hazards?
Well, a healthy lifestyle goes a long way. Eating a balanced diet with lots of fruits and vegetables can support your immune system and your overall lung health. Regular exercise is great for strengthening your lungs and making them work more efficiently.
Like a workout for your lungs, too.
Exactly. And don't underestimate the importance of sleep. When you don't get enough sleep, your immune system weakens, and that can make you more susceptible to infections, which can sometimes lead to lung complications.
So it's all connected, really, taking care of yourself holistically. Any other preventative measures we should be thinking about?
Let's see. Staying up to date on your vaccinations is important, especially for respiratory illnesses like the flu and pneumonia. That can help prevent infections that could damage your lungs. And it's always a good idea to know your family history. If you have close relatives who've had ILD or other lung problems, it's worth talking to your doctor about whether you might be at increased risk.
So early detection is key, as always.
Absolutely. If you notice any respiratory symptoms that just won't quit, like a nagging cough, shortness of breath, chest pain, don't wait, go see your doctor. It's always better to be safe than sorry.
Great advice. We've covered a lot of ground in this part of our deep dive,
We have.
exploring all these different types of ILD, their treatments, and even what we can do to potentially lower our risk.
And we've really emphasized that being proactive about our lung health is so important. It's not just about seeking treatment when something goes wrong, it's about taking steps to protect our lungs throughout our lives.
Such a good point. Well, get ready, because in the final part of our deep dive, we'll explore what this all means for you, our listener. How can we take this knowledge and actually use it?
Yep.
How can we become advocates for our own lung health? We'll tackle that and more when we return. And we're back for the final part of our deep dive into ILD. We've learned so much from understanding what ILD is, how it's diagnosed, the different types, treatment options, and we even talk about ways to potentially, reduce our risk.
It's been quite a journey, and it's clear that ILD is a complex area with a lot of moving parts. But one thing that really stands out to me is the importance of research and collaboration to really move the needle on how we understand and manage these conditions.
It's funny you say that because this source material we've been using, the one that helps doctors prepare for their exams, it really highlights the importance of continuous learning, even for seasoned medical professionals.
Oh, absolutely. What we've talked about here is just a snapshot in time. Medical science is constantly evolving. New research is coming out all the time. Treatment approaches are being refined.
So this deep dive has been super informative, but it's definitely not the end of the story.
Nope, not at all. There's always more to learn. And that's where you come in, our listener.
Exactly. We've given you the foundation. Now it's up to you to keep building on it.
Think of it like we've handed you a map and compass. You can chart your own course through the world of ILD knowledge from here.
What piqued your interest during this deep dive? What questions are still swirling around in your mind?
Maybe you're curious about the latest research into new treatments. Or you want to learn more about those specific causes and risk factors we talked about.
Whatever it is, go for it.
The best thing about knowledge is that it's out there for anyone who wants it.
You can find information online, in libraries, through organizations that are dedicated to lung health.
And don't forget the power of conversation.
Talking to your doctor, connecting with support groups, even just discussing what you've learned with friends and family.
It can all help deepen your understanding.
And sometimes it can spark new insights that you wouldn't have had on your own.
One thing that really resonated with me from this source is the emphasis on a multidisciplinary approach to managing ILD. It made me realize how interconnected everything is.
Right, it's not just one doctor working in isolation. It's a whole team of people.
Researchers, doctors, nurses, therapists, patients, their families,
Everyone plays a role.
and each person brings their own unique perspective and experience to the table.
It's that collaboration that drives progress and ultimately leads to better care for patients. So as we wrap up this deep dive, I want to leave you with one final thought. Knowledge is power.
Especially when it comes to our health.
By understanding conditions like ILD, you're empowered to make informed decisions about your health. Advocate for yourself or for your loved ones.
So stay curious, keep learning, keep asking questions.
And remember, this isn't just about ILD. It's about taking an active role in your own health journey.
It's been a pleasure diving deep with you into the world of ILD. We hope you found it valuable.
And that you'll continue to explore this fascinating world of health and science. Until next time, stay curious.